Woodward and Whit on 98.7 and 1330 KNSS.
8:07 here on this Friday, June 12th on KNSS.
Healthcare costs remain one of the biggest concerns for American families, and now the Trump administration is turning up the heat on hospitals. More than 500 of them have been put on notice for allegedly failing to comply with federal price transparency requirements, with potential fines reaching as high as $2 million. Joining us now is Ilaria Wheeler with Patients' Rights Advocate, a group that has been leading the fight to make healthcare prices more accessible and understandable for patients. Good morning, Ilaria. Thank you for joining us this morning.
Good morning. Thank you for having me this morning.
So for listeners who may not be familiar with these rules, what exactly are hospitals required to disclose under the federal price transparency law, and how widespread is the noncompliance?
Yeah, so you don't need to be familiar with the federal regulation to understand that you can't really see healthcare prices up front, right?
Right.
You walk into the hospital and you don't know what you're paying, even though you try to get the price up front. And you only really know what you're paying weeks or months later when you get the final bill in the mail. This is no longer. Hospitals are now required to post their prices up front in dollars and cents on their website so patients can shop for the best quality of care at prices they know they can afford. President Trump got this done in his first term, and the rule sat on the shelf for a little while. There wasn't much movement there, but President Trump and his administration has put over 500 hospitals on notice for failing to post their prices up front. So if hospitals were not paying attention to price transparency before, they definitely are now.
There's now over 500 of these hospitals that could face penalties. Why are so many of them failing to meet the requirements? And what happens next?
Yeah, so I think it's important to note hospitals never wanted price transparency to begin with. Of course not. When President Trump got this done in his first term, the Hospital Association sued to keep their prices hidden, right? So if there was no enforcement, they were lackadaisical about posting their prices, but no longer. This is the largest enforcement action in price transparency history, and I think it's a signal that this administration is not, messing around when it comes to hospitals not posting their prices. 96% of Americans want healthcare price transparency. Healthcare affordability is a major concern for American voters as we, are approaching, midterms, and I think patients deserve to know prices up front, and this administration is delivering on it.
This is the whole, $500 for a box of Kleenex issue, correct?
This is 100% that issue, and I actually want to give you a story that'll describe the issue perfectly. We just helped a patient who went to the hospital, and he got a $238,000 bill out of pocket. How can a hospital reasonably charge a patient $238,000 and expect them to pay it? That beats me. We leverage the price transparency data hospitals are now required to post, and we negotiated the bill. We found overcharges. We found services he wasn't even provided, right? And we disputed this bill to the hospital. They negotiated it down to $98,000. We said, nope, not good enough. That's still crazy. They came back at $24,000, still way too high. The final bill we settled on was $9,500, and that's only because we were able to see the prices up front and identify the areas that did not make sense and that were overcharged.
There's another bill that's in Congress right now, the Patients Deserve Price Tag Act. What would that do?
Yep. So there is a bipartisan bill in the Senate right now to make this the law of the land and strengthen the price transparency rules even more. The Patients Deserve Price Tags Act would shift power to the patients and require upfront prices before care, just like any other industry. With this bill, lawmakers have the opportunity to back President Trump's agenda and really put patients first.
Well, we appreciate you coming on this morning. If folks have questions, if they want their lobbyist or their legislator, rather, to get behind that bill, they can find information at patientrightsadvocate.org, correct?
That is correct. And, if there's anyone that has a medical bill that they don't know what to do with, go to patientrightsadvocate.org, reach out to us. We help patients across the country fight their medical bills. And when we do dispute these overcharges, hospitals come back to us and say, oh, that was a glitch in our system. So how many patients are paying medical bills due to a glitch in the billing system?
Ilaria, we appreciate you joining us this morning. Thank you.
Thank you for having me.
It is 8:12.